For a CIO right now, mobile represents a arena that's been kind of untapped. We've got a lot of people approaching us, both on our clinician side. Our doctors and nurses are looking for ways to get more mobile. Most of them are using mobile in their personal lives pretty extensively, and they're trying to figure out ways they can leverage their existing mobile devices so they can combine the use of their personal devices and their need for work devices. And so we're trying as CIOs to find ways to do that, to make the delivery of our solutions more creative using mobile devices. And then strategically, we're looking at how can we do this for our patients, because I think in the community at large, you see with retail health care and just retail in general, that the consumer is gravitating towards mobile devices, and we believe in healthcare, they're looking for that as well. No, not at all. I think that there is a long way for us to go. I think that the consumers are looking for real convenience, and historically our applications haven't been convenient to begin with. So I don't know if you use a patient portal, but you'll see that if you do use one, most of the patient portals that are out there are kind of clunky just on your computer, let alone using them on a cellular device or a tablet. And so I think we need to make the tools easier for the physicians, for the patients, and then I think we're going to see more adoption. But so we struggle with a problem with our kind of legacy tools, and then the fact that we're not necessarily as skilled at delivering on the mobile platforms as we should be. What we did was we realized we wanted to build more of a holistic mobile strategy, and we were looking for guidance. And we went out to some firms that do this kind of work, consulting work, and teamed up with a gentleman in that arena named Ken Kleinberg. Ken and I worked together and did some research, and then he helped pull together a mobile strategy and sort of a maturity model for how organizations can think about mobility and try to prioritize their mobile initiatives, as well as try to set a framework around where they'd like to be in terms of how aggressive an adopter of mobile technology they'd like to be. So it's a starting point. I think it's something that will continue to mature. What we're doing is presenting at least a framework that others can use to help them in their journey to become more mobile enabled.